Hi, my name is Katie Costello, and I am a Bachelor's of Science in Nursing student at Mercy College of Nursing and Health Sciences. Today, I will be talking about CAUTIs in the hospitalized elderly client. Why it is important. To me, it is important because it is part of my job as a nurse to be educated about catheters and how to properly care for clients with them. There's been many times where I have seen nurses leave catheters in for a prolonged period of time just because they found it convenient for them. However, this increases their patient's risk of an infection. While it is important to the public should be educated about common healthcare procedures and equipment. Catheters are very common in the hospital from all ages. I think the public should know the knowledge because this is a basic procedure. Why this is important to the healthcare system. The healthcare system should be up to date on the most recent evidence-based research to provide the safest care to patients. Improvements can be made upon evidence-based research. Example, evidence showed lining the catheter with antimicrobials such as silver decreased the risk for infections. Why this is important to patients. The patient should be educated on risk associated with procedures, including having a catheter. Example, patients should know they are at an increased risk for infection. Many times I have seen catheters placed. Nurses explain why they need the catheter and how the procedure will go, step by step. However, I have never heard a nurse tell a patient that they are at increased risk for infection. I believe this is something they should know. PCOT statement. The PCOT stands for Population, Intervention, Comparison Intervention, Outcome, and Time. The population I have decided to study is the elderly hospitalized client with catheters. This is because majority of our hospital population is the elderly and majority of them do have catheters. My intervention is removing the catheter in a timely manner. Most often I see catheters left in place because it is convenient to the nurses. However, they should be removed due to infection. My comparison intervention is prolonged catheter use. Again, being left in longer than they should be, but in some cases, catheters are used in long-term care. For example, acute care settings, I have seen catheters used for a prolonged period of time. The outcome is decreased CAUTIs when removing them in a timely manner. Time was not needed for this assignment. Search for articles. The database I've searched is CINAHL Complete. This was used through my Southwest Baptist University library. The search terms, urinary catheters in the elderly. My bootling operators, urinary and catheter and elderly and infection. The results I got with this was 3,062. Limits and expanders. These include full-text articles, academic articles, years 2012 through 2018, and 65 years or older that had catheters. Once I entered my limits and expanders, it brought my search down to 67, and I was able to pick out the articles I needed for my research. Rationale for article selection. The articles I have chosen met all the requirements for my research, which include elderly in the hospitalized setting that had catheters. They both researched risk factors that would increase the rate of CAUTIs. They also both had inconsistencies I could compare to one another. My instructor gave me feedback I was able to incorporate into my final project. These include improving my PCOT statement, which I struggled with at first. I didn't quite understand, so there were some adjustments I had to make to my population, such as making it more precise. Instead of just having the elderly client, I put them in a hospitalized setting, which limited long-term care facilities are those who are taken care of at home. I also struggled with my intervention and outcome. Once I was able to get things straight, it made research easier. Better search terms. I used better search terms to narrow down my article selection. Once I was able to get better search terms, articles became easier to pick out. Staying consistent with articles I was researching. When I first selected 5 articles, they were all over the place, from decreasing catheter time to different antimicrobial use. However, once I adjusted my PCOT statement, that really helped me stay on track and be consistent with articles I was researching. Similarities. The similarities I found when comparing two articles were these. Elderly population in the hospital. They both used male and females. They both included patients with catheters. They both looked at incidences of CAUTIs. Both found that the longer the catheter is placed, there is an increased risk for infection. Both used randomized groups. Urinalysis was used to collect data. Inconsistencies. These are the two articles I have used to compare, and as you can see, they both have several inconsistencies. The first article is Female Gender as Harmful as Bacteria, Analysis of Hospital Admissions for Urinary Tract Infections in Elderly Patients. First, it took place in Italy, found more infections in women, had a population of 2,266, only looked at acute care settings, found an increasing age was a risk factor for CAUTI, and found mortality was higher in catheterized patients. The second article, Incidence and Risk Factors of Catheter-Associated Urinary Tract Infection in Iran. It took place in Iran, had a population of 324, which is much smaller than the other article. It did not find evidence there is an increased incidence in women. However, they do note that it has been found in other studies. While the study did look at acute care settings, they also researched other areas as well. These include neurology, cardiology, infectious disease, and internal medicine wards. They also did not find evidence that increasing age was a risk factor for CAUTIs. Again, they did note that other studies have found this as a risk factor. Limitation and gaps. Limitations are factors that may complicate interpretations of the findings. Gaps are suggestions for further study that support the research of the question. In my first article, it was only done in acute care setting in Italy. There was a lack of specific data on CAUTI and catheterization rates in the elderly population. This limitation made it difficult to interpret and compare the data obtained from the surveillance study in the acute geriatric setting. In my second article, it was only done in a small hospital in Iran. Departments and wards participated differently regarding consistency, amount of their contribution, and duration of adapting infection control guidelines. Mixed infections were not evaluated regarding number of strains, colony count, and antimicrobial susceptibility. There was no precise scaling for classifying patients with regards of their own self-care. Conclusion. In the conclusion, I will be answering two questions. The first one, explain why you feel that there is or is not evidence to support a practice change. Though the articles did have inconsistencies with each other, I believe there is enough evidence to support practice change. Both studies show the longer the catheter was kept in place, the greater there was a risk for a CAUTI. My second one is, if you found a guideline on your topic, is there evidence found from the article strong enough to overrule the guideline? Or, if you did not find a guideline, is there evidence to support a practice change or support the use of comparison? So, I found several algorithms that showed when it is okay to take out a catheter. I have used these algorithms in nursing school and at work. Also, Mercy College of Nursing and Health Sciences showed them as an example in the classroom as well. There were several times when I was in nursing school where a patient had a catheter and we had to use the algorithm to see if they needed to take it out. Most of the time, they did need it taken out. However, it was not taken out right away. Another example I have of this is when I was working at Mercy Orthopedic Hospital. Many clients had catheters upon hip and knee replacements. Though it was convenient for us to keep the catheter in because the client was receiving lots of fluids and had to take several trips to the bathroom, we used the algorithm. After using the algorithm, we determined that it was better to take out the catheter because the long-term catheter use would increase infection. Therefore, we would remove catheters for the safety of our clients. This concludes my presentation on CAUTIs and the hospitalized elderly client. I hope you learned a thing or two about removing catheters in a timely manner to prevent infections. Thank you.